Urinary urgency or urgent continence, or the leakage of urine that comes with the strong sense of urge, is a very common problem. I find that many of my patients seem to just chalk it up to growing older or just being part of what it means to be a woman, but it doesn't have to be. We have so many options for treatment now that are minimally invasive and have less side effects than they used to with the drugs that we had in the past. In terms of management, we start out with either behavioral changes. Many women are told that they have to drink 6 to 8 glasses a day, but even though it's always healthy to drink, some people just don't need that much fluid. Or, they drink a pot of coffee in the morning, or, whatever it is, they don't notice that all the fluid that they're taking in has to go somewhere, and so that might be associated with some sense of urgency. That being said, most of the problem isn't because of what we're doing. It's just something that's gone on with our bladder, with the nerves of our bladder, the lining of our bladder. And so from there, other options include either physical therapy to try to retrain the bladder, or medications, and some people even try both. Many of my patients have tried medications in the past, and they've complained of dry mouth and constipation. And certainly, whereas most of the medications that we have now continue to have some of those side effects, the newer formulations that are longer acting tend to have less of those side effects. Furthermore, there is a newer drug called mirabegron that is in a different group of drugs than the previously available ones that does not have those side effects and could be a good option for people. From there, if those don't work, the next set of options is one of 3. One is something called Peripheral Tibial Nerve Stimulation, or PTNS. And what that entails is having you come in once a week for a series of 12 weeks for the treatment, in which we put a very small needle, kind of like an acupuncture needle, into the ankle area, and it gets stimulated. You can sit and enjoy reading a book during that time. Many of my patients find it therapeutic. They like the minimally invasive nature of it, and that has about a 70 to 80% success rate. From there does tend to be some sort of maintenance, whether that's once a month, once every 3 months, once every 6 months. It kind of depends on the patient. In lieu of that, there's another treatment called InterStim. This is an implantable device that goes into the back area, in which a wire runs alongside the nerve that controls the entire pelvic region. What's nice about this device is you get to try it out before you actually have it implanted. The trial entails you coming down, and we inject a little bit of local anesthetic into your lower back, pass a wire that runs along the nerve on either side, and you get to wear this device for a few days on one side and then for a few days on the other side to see which side worked best for you. After a week's time for the trial, you come back and either let us know that this worked great or it didn't work at all, and which side worked best for you. We're looking for at least a 50% improvement to make it worthwhile to have the implant. But many of my patients are so grateful and wish they tried this treatment sooner. Finally, we have something called Botox, and unfortunately it does not remove the wrinkles from the bladder, but what it does is it paralyzes some of the muscles inside the bladder, so it's not so trigger happy and squeezing when it's not supposed to. We'd love to see you. Come on in and we'll talk to you more about some of these options and find what's best for you.